This has to improve. It's unacceptable for people living up north.
Staffing shortages continue to be a major problem in hospitals and health centers in rural and northern Manitoba. And for the residents living there, they are fearful that the care will not be there when they need it most. It's a situation that is progressively getting worse. Residents in Leaf Rapids, Manitoba, about 979 kilometers north of Winnipeg, continue to live without proper access to basic health care.
Of course I feel scared. There's no hospital here. It's always closing. And I have a 4-month-old. Makes me scared, yes.
On July 12th, the around 600 residents living in Leaf Rapids were informed that the emergency department closure would be extended until the end of August due to staffing issues. Elvira Biggity has lived in Leaf Rapids for 16 years. She says she's never seen anything like this before, and it's putting unneeded stress on her family.
I have 5 kids of my own, and I don't want to travel, 3 hours, 2 hours away if they're really seriously hurt in an ambulance. We'd rather have doctors and nurses here so they could be helped here.
72-year-old Stella Spence suffers from asthma attacks often and is constantly in need of urgent care for other medical conditions. Last week, Spence suffered a medical emergency and was transported from Leaf Rapids to Lynn Lake by ambulance, the nearest community with an emergency department, which is about an hour and 20-minute drive northwest from her home.
It took 40 minutes for the nurse to see me, another 60 minutes for the doctor to see me. I had an x-ray and diagnosed with a lung infection.
Spence says the long drive between Leaf Rapids and Lynn Lake and the delays at the hospital almost killed her.
It's not a very good situation.
Spence says Leaf Rapids used to have a Medivan that would transport patients between communities for emergency purposes, but that has since been removed. Rosalie Linklater says the emergency transportation needs to be brought back now.
We need a transportation back and forth to Thompson whenever we have appointments to go see a doctor, unless they can't afford a doctor here. At least we could have a nurse.
We reached out to the Northern Health Region for comment on this situation. A spokesperson told City News that primary care and health services are still available between Monday and Friday during the day, citing it's not a full closure of the health center in Leaf Rapids. Quote, the NHR is dedicated to doing what they can to prevent closures of health centers. Review of staffing levels as well as innovative models of care are being planned and implemented with stakeholder involvement. But Biggity feels the residents in Leaf Rapids, including herself, are forgotten and not cared about.
There's no one here looking after us here in Leaf Rapids.
The emergency department in Leaf Rapids is expected to reopen on August 31st. In Winnipeg, Alex Karpa, City News.